Good afternoon. I'm Monica Hendrickson, the Public Health Administrator for the Peoria City County Health Department, and welcome to the Tri-County COVID update for July 22nd, 2001. Currently, the Tri-County is reporting to date 45,961 cases. That includes 769 total deaths. 98% of our cases are considered recovered, and 0.45% are at home isolating. Hospitalizations account for 0.03% of our cases. Currently, Peoria County has 23,705 cases and reporting 375 deaths. Tazewell County is reporting 17,300 cases and 297 deaths, and Woodford County is at 4,956 cases and 97 deaths. In recent dates, the deaths reported in Peoria County were all non-vaccinated individuals. And to give perspective of why we are having this briefing, on July 1st, our 7-day average for Peoria County was 1 new case per day. Today, we are back up to double digits. We are reporting an average of 10 new cases each day. Our positivity rate has doubled in the past 2 weeks, and our zip codes where we have the lowest vaccination rates continue to have our highest number of cases. Many of the trends we are seeing and related to our cases is recent travel from high-risk areas, camps, conferences, and workplaces, facilities that are not participating in masking or social distancing or asking for vaccination status. Additionally, in terms of our cases, in June, Peoria County reported 100 new cases for the entire month, with 32% of those cases attributed to individuals under the age of 30. Similar, Tazewell County reported 103 cases in June, with 28% attributed to individuals under the age of 30. And Woodford County reported 62 cases in June, with 29% under the age of 30. With July not completed, Peoria County is already surpassing their June values, with already at 115 new cases, with that population under 30 attributing to 47% of our cases. Likewise, the 0 to 29 population accounts for 36% of those cases in Tazewell County currently, and 37% in Woodford County. The hospitals are still below what they were seeing in their high levels, with currently both systems utilizing 21 beds in use, with only 6 beds in the ICU. There's been a lot of information that's been coming out this past 2 weeks, both around the Delta variant as well as for back-to-school guidance. To talk about these topics, I'll introduce Dr. George McKenna, Peoria County Regional Office of Education.
All right, good afternoon. I'm glad to be here to discuss what our school districts here in Peoria County are doing to develop their plans to open up school in the fall to in-person learning. Our schools and communities know and understand that in-person instruction is the best way to address students' academic and social-emotional needs. Friends, classes, athletic programs, co-curricular activities give students a sense of connection and belonging. Without a doubt, since the beginning of the pandemic, our school leaders have been working tirelessly to design and implement strategies to keep their students, staff, and communities safe. Coming into this year, their work continues. The most recent guidance from the CDC, adopted by the Illinois Department of Health, Illinois State Board of Education, and local health departments, has shifted the levels of responsibility for mitigation strategies from national or statewide mandates to the local school districts and their school boards. Members of the community will see their plans reflected in press releases and on their websites as they continue to discuss exactly what their mitigation strategies that they're going to implement in the fall look like. Districts are considering plans to address 4 tiers of mitigation strategies: vaccination, masking, social distancing, and proper hygiene. In addition, they're screening students through testing, addressing ventilation issues, communicating the need to stay home when ill, contact tracing practices, and continuing their cleaning and disinfecting procedures. They're continuing to take a look and continuing to research what the absolute best practices are to keep their students safe. In all of our conversations, we discussed the need for a layered approach to mitigation strategies. No strategy is 100% effective, but the combination of strategies proves protective means for preventing infection and the possibility of serious health issues resulting from COVID-19. Every school district is dedicated to monitoring their local conditions and making adjustments to their plans based on changing information through community data or discussions with local or statewide agencies. I'm sure that the press release that went out today will be one more piece of information that they use, that they review, and that they share with their school boards, and that they will ultimately consider with any plan. I've done a number of media interviews, and we always say this is the best information at 9:30 in the morning on a Monday, and it could change by 9:30 a.m. tomorrow morning. And so our schools are extremely responsive to any new information. But here's what I want everybody to know. We all want what's best for students. In-person learning with appropriate layered strategies based on local conditions is the key for success in each of our communities in Peoria County. And up next is Dr. Douglas Casper.
So, hello, I'm Dr. Douglas Casper, the Section Head of Infectious Disease at the University of Illinois College of Medicine at Peoria. I participated in a few briefings, and today for me is a little different. The prior briefings were all during times of high in-hospital COVID cases. As Ms. Hendrickson mentioned, we currently have low in-hospital COVID cases, both ICU and floor beds. This has been a wonderful success that is due to both vaccination and public health measures that were enacted over the previous months. What we are seeing, though, is across the country, in areas where vaccination rate has not peaked at its potential highest number, the case rates of COVID-19 are reemerging and leading to both hospitalized outcomes, including ICU and increased mortality rates. What this has to do with is the emergence of a Delta variant strain of COVID-19 with increased transmission, especially in any person of any age who is not vaccinated. As Dr. McKenna discussed, as we are entering into full return to school, which will be for the first time during the pandemic, this fits into many different age groups, including those that are currently approachable for vaccine, those 12 and older, and those that are not yet cleared to receive vaccine. What we want to do is keep COVID-19 case rates as low as possible to protect those that cannot receive vaccination yet, or those that might have underlying condition where vaccine is not known to be fully protective. At this point, all 3 FDA EUA-approved COVID-19 vaccines provide high efficacy for preventing the severe effects of COVID-19. So I will state that again, that if you have not received vaccine, now is the time to do it. The emergence of the variant strain does not mean the vaccines are of any less utility or of any less importance. In fact, I would say they are even more important as we have now reopened not only local activity, but travel, and in the near future, schooling. And so as we are all very excited to get back to many normal activities, and it's been wonderful to do all sorts of things this summer that were not open or unavailable last year, We need to use as evidence what we are seeing not only across our country but across the world, that in an unvaccinated population with Delta variant of COVID-19, case rates will continue to rise. So now is the time to pursue vaccination. We hope to have more data about vaccine being more applicable to all school-age population. But in the meantime, we continue to push for guidance given by both the CDC and the American Academy of Pediatrics that in situations of being unvaccinated, it is recommended to wear a mask, especially with indoor situations with many people. So I can take any questions now if anyone has any.
One question about the Delta variant. So this is not the first variant we've heard about. Is there anything about Delta in particular that is more worrisome or, potentially more dangerous than some of the past variants we've heard about?
Yeah, the variants have been renamed since the prior time I was at this conference, and so the variants now are for the Greek alphabet. What they're referring to, the Delta variant, is a set of mutations within the virus that make it more transmissible. People that have become infected with Delta variant have higher concentration of virus in their nasal and respiratory secretions. It makes it more likely if somebody who is unvaccinated comes in contact with a Delta variant, someone who is spreading Delta variant, that they will become infected. Now, fortunately, the vaccines, both Pfizer, Moderna, and Johnson & Johnson, protect against Delta variant to a very high rate. Most recent indication from New England Journal yesterday was that the Pfizer vaccine remains protective at 88% for completion of a 2-shot series. So part of stopping future drive of variants is increasing vaccination to stop viral replication. And so while there is a benefit, and is a huge benefit to the individual to become vaccinated, there is also just as large a population benefit by stopping viral replication and the development of future variant strains.
How does the Delta compare, say, to, I don't know, B117 in terms of, is Delta more severe than the past variants?
Severity, in this case, what transmissibility will outcompete that, meaning that the more transmissible form is the dominant form. I think well up to 80% of cases. So severity is always assessed retrospectively, and so the data with severity will not be back while we currently have the data with transmissibility. But for the points of discussion, the severity becomes almost irrelevant in a vaccinated state because the vaccines protect highly effectively against any circulating strain once vaccine series is completed.
Are there any other variants on the horizon that you all are concerned about?
So variants of concern are being logged at all times, meaning that departments that can do viral sequencing are taking batches of new cases and seeing if there are emergence of new variants. You may have heard of a Lambda strain, which is a strain that was first found in Peru and has since been found throughout the world. Again, the key with variant strains is that they have some adaptation that has allowed the virus to spread more conveniently within a community. That's why they become a variant strain. The key with all of them will be looking at current vaccines that are given and seeing how they protect against a variant strain. And so to date, vaccines remain highly effective. You've heard that booster or third shot series have been investigated, which may have some modification if needed to cover a variant strain. So these things are always sort of a moving target. But the best strategy is to keep case rate as low as possible by vaccination, which not only protects individuals, but it stops the development of future variant strain.
Reddit's laboratories yesterday reported that they now found like 64 cases in their, random sequencing, and that's up from like the 2 that they had found before. Is that concerning to you?
No, viral sequencing is not done at a regular hospital level. So it's done in specialized lab settings. And so it is not normal procedure to type every case of COVID-19 virus to look at specific sequencing. So what I'm most interested in is outcome. And the predominant outcome that I track is hospitalization rate, and then people that how their clinical cases progress from there. So while we always want the real-time data of what type of virus is circulating in the community, what we want to compare that to is that leading to hospitalization and significant outcome? And as the main benefit for the individual, again, from vaccine is preventing severe outcome. Where you may have heard about increased breakthrough cases, which would mean somebody who's vaccinated subsequently develops, tests positive for COVID-19, that by itself is not a negative indicator at all. What we are looking for is, do those infections lead to hospitalizations? And overwhelmingly, hospitalizations and negative outcomes, ICU stays and mortality, are seen in an unvaccinated population at a 95% clip.
On those breakthrough cases, we were just wondering, do we have them here? How many of them are there? If we do we have any kind of statistics on them?
Yeah, you always have breakthrough cases. No vaccine is 100% effective. And so built into vaccination is that there will be people who are vaccinated that end up developing infection post-vaccine. Again, what I'm interested in is the severity of that infection. If that infection leads to ability to care for self at home, that is manageable for our population. What we are not seeing is that people that are vaccinated are not breaking through and requiring hospitalization. And that's a generalization at a large level. Certainly there are instances of transplant patient or something where that doesn't hold. But for the community as a whole, vaccination is incredibly effective at preventing severe manifestations.
Sure. But locally, do we have any of those cases here, or do we not? Or is that a problem?
There will so anywhere we'll have cases of people that are vaccinated with COVID that eventually test positive. Here, any city, the vaccine does not prevent you from coming into contact with COVID, and it does not prevent it from being introduced into your body. It's preventing the severe outcome. So where I'm trying to draw the line is that breakthrough by itself does not indicate severe disease, and severe being hospitalized. And that really is the goal of vaccine from the beginning.
Do we have any cases specifically though here, or like, is there any stats on that? Or?
I don't have any stats. Our local rates at this time are very low, and upwards of 95% of our local cases, which also mirror national cases, are an unvaccinated population. Yep. Okay. Thank you.
In fact, Dr. Kasper, I do actually have our data point for Peoria County. First and foremost, for our vaccine breakthrough cases, we do investigate them to confirm that they're what's known as true breakthrough cases. With that, it is less than 0.5%. So as Dr. Kasper mentioned, the 95% lower than that. Every case we investigate with a vaccine to make sure that it is a true breakthrough case. Because some individuals might, depending on where they are in their series or have not completed their full 2 weeks post last dose, can still be infected with COVID as well as test positive. And again, there's a great distinction I think Dr. Kasper made, which is the fact that vaccines are preventing the severity of the illness and the mortality of the illness, and that's what we really want to focus on. Are there any other questions from?
Yeah, so Monica, I'm going to throw out maybe a few things I've heard at some local school board meetings, both from parents and from school board members, about why mask optional is a better thing to do, at least why they think that. And I'm basically asking if there's any merit in these arguments. So what I've heard things such as wearing a mask causes either breakouts or some type of illness. I've heard people say that wearing a mask in children affects their social emotional development because they can't read nonverbal social cues as well. I've even heard things that, forcing, non-vaccinated kids to wear masks will create a stigma which might lead to them being bullied by the vaccinated kids. I've heard all of these things from actual people. So I guess my question is there any merit to any of this in terms of mask optional being a good idea?
So, I would be really interested to know those data sources, other than just a kind of an opinionated approach to this. Acne, which actually is really highly, even without masks, there's a lot of teenagers that suffer from acne as well. So I don't necessarily know if that is something that we can correlate just to mask usage versus just natural puberty where acne does happen. But I think the key thing to recognize is that we've been talking about the importance of vaccination. There is an entire population that the vaccination rate is 0%. And those are children under the age of 12. So when we're talking, as Dr. McKenna mentioned, is that we want a layered approach. The approach you use for a 35-year-old, the approach you use for an 18-year-old, even a 12-year-old is going to be different than a 2-year-old, a 3-year-old, where they are ineligible to be vaccinated because it does not exist yet for them. For them to maintain social distancing is, again, difficult just because of their maturity level. And again, you're looking at screening of them or testing of them routinely, which can also be difficult. So masking becomes imperative for them. And that's why I would just, again, want to reiterate, if you have not seen it, the Tri-County did release a press release in conjunction with Unity Point Health, OSF Healthcare, UIComp, Heartland Health Services, and Carle Health Center, strongly encouraging the fact that unvaccinated individuals need to mask. If you are not, because we talk about this as the optional vaccine group, and that's great for people 12 and older, right, to have the option. But there's an entire population that does not have that eligibility at all. And I think we really need to focus on what it means for them as well. So I think those data points are interesting, but I can also, reference the data points about where we're seeing transmission, whether it's asymptomatic, with a more contagious or transmittable Delta variant. We're seeing those cases increase in that younger population, and they are getting ill with it. So I think Dr. Soder said it best, which is oftentimes we've talked about COVID in the realm of adults, and we ignore the fact that just because children are not dying from it doesn't mean they're not impacted from it.
Absolutely. So looking at those kids under 12, that being said, it is an individual school district decision. A school district could decide we're not going to make kids under 12 wear masks. I mean, that's certainly something that could happen, right?
I would just strongly look at the other layered mitigation. If you are unable to vaccinate that population and you're choosing them not to wear masks, then you have to look at the other two, which is distancing. So make sure they're more than 3 feet apart, as well as looking at the option of routine surveillance testing. So the CDC guidance also include the fact that if you decide to go in these layered mitigations, that population gets screened. Right now, none of our school districts that I know of have signed up for that screening program that was offered through the SHIELD program. So again, you have to recognize that even within a school district, there's going to be different layers of mitigation by age ranges as well.
Have any of the school districts been testing children under 12?
So not to my knowledge that they've done that. I will say, though, I do know of 2 school districts that have actually shared their reopening plans with me.
Which districts are those?
The first one was Peoria Public, and the other one is Limestone High School.
Can you talk about how vaccine outreach has changed since we last were here? Because obviously now it's at a point where vaccines are widely available. Is it just battling misinformation and other things like that?
So vaccine outreach has changed, and I think exactly right. We are battling misinformation. We're also just trying to get access to individuals. I think Dr. Casper and I were talking just briefly that, having a large-scale get vaccinated is not necessarily going to work now. It's having those individualized conversations with people to talk to them about the importance of getting vaccinated, what it means, the implications of it. And so a lot of what we're doing now is working with our neighborhood associations, working in any space where we can have a one-on-one conversation just to get individuals vaccinated. And a lot of community partners have come up in support. I think what we're seeing on a global level is that, this time last year we were coming out of stay-at-home orders and kind of reassessing summer, but all of us were kind of just at the same point thinking about, we wish there was something magical that we could do to just end this. And vaccinations are that. It is a pharmaceutical method to actually get ahead of this pandemic, and with a decline in vaccinations or people not having interest in it, you're slowing down our recovery. You're slowing down the process for us to actually get ahead of this and actually get out of this. And so again, just, you know, we're going to have these discussions about the social emotional well-being of the public in general, not just youth, but adults as well, because again, many of us still continue to look at masking as a way, because we have to protect the ones that are at home that are unable to get vaccinated. So I think we have to really start talking about this in a conversation about, you know, everybody needs to do their part. And we are lucky enough to have a pharmaceutical option for a majority of our population, and we should all be taking advantage of it.
So I've been speaking with parents who are concerned going back to school and their children aren't eligible to get vaccinated, and they were concerned about being inside of schools who are offering that optional choice of whether or not to wear masks. And they were wondering, you know, will the health department be enforcing a masking policy or something like that? Because you guys do say you are following the CDC's and the IDPH's recommendations for those 2 and older who are unvaccinated to wear masks. So they were just concerned, like, can there be any enforcement in that?
So the school districts are responsible for, it's a local authority for them, as Dr. McKenna mentioned. And that's why in that press release, we really would like for our boards of education to really focus on the science and the data out there. And the science and the data says unvaccinated individuals need to be masked, to, not only for their own health, but to further control the spread of the virus. And so we really hope that with not only the 3 local health departments, but our largest healthcare systems supporting masking of students that are unvaccinated, that our school districts will respond accordingly.
You mentioned either D2 plans, the Peoria Public Schools and Limestone. Can you talk a little bit about what's their policies on masking and vaccinations?
So again, both school districts are promoting vaccinations. In fact, we actually had a clinic at Limestone High School recently where in one day we did over 50 individuals, which is a lot now that we've kind of slowed down. We were actually doing maybe 2 or 3 here and there. So for Limestone, again, kudos to that school district for promoting it. There's going to be vaccination clinics also in Peoria Public coming up. And so both schools' plans had a vaccine promotion plan. They also had great metrics in terms of understanding the levels of infection in their schools. There's hygiene practices, and they did have masking as part of it. Also recognizing there's going to be tiered parts of masking. You know, if unvaccinated individuals are masked, there could be a level where their school gets to a certain point, or the community gets to a certain point, that we have to go back to universal masking. And so, again, I applaud both school districts for their layered approach, and it was great to see that 2 of our school districts take such a proactive role.
So is that mandated masking for the unvaccinated, or optional, or how does that work?
I think they're still working through, because the Illinois Department of Public Health and ISB are actually pushing out some frequently asked questions over this week, and so I think they're going to fine-tune it, but both of them had levels of required masking depending on vaccination status, as well as depending on what the CDC also quoted as the community transmission rate.
Monica, do you have any sense of when vaccines for 12 and under are going to come?
I really wish it already happened, because I am one of those parents that kids are not eligible for vaccines. But right now we're looking at September, October. So that's what we've been hearing as the EAU would be authorized, and then from there, like we saw with other vaccinations, really quickly be able to start actively pursuing that. So I'm hoping, I wish it was yesterday, like all other parents that are interested in getting their children vaccinated, but it looks like October right now.
You gave us that data point, the 0.5% of the breakthrough cases. You're referring to the Tri-Cal area, that's Castle, Peoria, Woodford County?
That was specifically Peoria County's data. Mm-hmm.
Do you have anything on hospitalizations for that or no?
For the breakthrough?
For like breakthrough hospitalizations?
It was, I think, my data point. Well, thank you very much. Appreciate you guys coming.